Hello and welcome everybody to another exciting episode of Side Talks 2.0. If you guys can hear me, please say something. That way I know everybody's good and I will get my guests as well. Tracy,
Hey, Jack, I can hear you.
can you hear me?
Yeah.
Okay, awesome. Let me just get a couple of things worked out here before we get started. Let me take off this sign saying that we will start shortly. Okay, let's get the comment section going so that people could chime in and ask us questions, and that way everything is good to go. Can somebody please let us know if you guys could hear us and see us well? That way we get started. Just throw in a comment, say something. Tracy, how are you feeling?
Good. Good. Long day at work, but it's good.
Long day at work, huh? Okay, you'll tell us a little bit about your work. So, before we get started, I just want to quickly introduce myself again. As most of you already know, my name is Dr. Jack Saxanian, and you guys are on Side Talks 2.0. Today, I have a very exciting guest. I've had her on the show once before when she talked to us about her experience in dealing with the coronavirus. She went through it, she experienced it, and now today she's back to talk to us about what it's like to be uh, a patient in the emergency room. Most of us, unfortunately, have been there because of our loved ones or ourselves, and sometimes it's very confusing. You feel like you're lost. There's so much commotion, there's things going on. And so she has started a very wonderful website and a coaching. Is that the right word to use, Tracy? Coaching?
Yeah, coaching, health advocate.
Health advocate coaching for people to do the things necessary so that they don't feel lost and can be their own advocates when they're in the emergency room. Now, a little bit about Tracy. Tracy, I've known her for, I'm not gonna date ourselves, but almost close to 15 years now, right?
Yeah,
It's been a
wow.
long time. It's
You're
been a
really
long
dating.
time. We used to play ice hockey together, and it was good times. That was before COVID, right, where we could go out and play. But she's also a nurse in the emergency room. I'll let her give us a little bit more detail. But she's been a nurse for a very, very long time, probably as long as she's been playing hockey. Um, and she's worked with COVID patients. She currently works with patients, but she's also been a patient in the emergency room, and she's seen it at both ends of the spectrum of what the chaos could be like and the things that you need to kind of know and be ready and be prepared and things you could do at home, especially the elderly, that could help make going to the emergency room as easy as possible, if that's at all possible, because we know emergency rooms are not a fun place to be, right? So with that, Tracy, can you just quickly introduce us to yourself, what you do, a little bit about your background, and this initiative that you've started, and that I wanted the wonderful audience to know about?
Okay, Jack. So I spent actually a long time in healthcare in one way or another. Went to college, became a commercial dive medic. So learned how to be an advanced diver medic, where we learned how to take care of dive injuries, hyperbaric medicine, all that kind of stuff. So that's kind of where I started my medical career way back in, oh gosh, I think 98.
Now, no. So from here on out, there's two time points, right? I call it pre-COVID and post-COVID, right? You know how we
Yeah,
used to have AD and DC.
pre-COVID.
Now so anything it's pre-COVID or post-COVID, so we don't have to say the actual years, so we don't have to date ourselves.
Yeah, totally. So then after that, spent a little time in dive medicine and went into the EMT, emergency medical technician, intermediate. Spent a couple of years treating people on ambulances, and then went into the fire department, became a firefighter, paramedic. So throughout then, I ended up injuring my knee, was unable to continue as a firefighter, so I ended up in nursing school. So I've been a nurse
Mhm.
for about 11 years now, almost 12. and most of that in an ER. So 10 to 11 in that in an emergency department. I just recently left the emergency department about, I don't know, 4 or 5 months ago. And now I work in a surgical center doing pre-op. I do recovery and work in GI lab. So I have a wide range of healthcare experience. And I've learned a lot over the years, a lot. And I've also learned how much the public is lacking in their basic health care amongst themselves, not necessarily nutrition and how they eat, and in many cases it can very well be true, but just how to deal with the medical system, with the healthcare system on the medical side. And then, I mean, the whole different world on the insurance side, right, Jack?
Right, right.
Medical side, and I'm sure, Jack, you've experienced this as well, correct?
Yeah, it's I've been a patient, and of course, as a physician, it could be very chaotic to say the least. It's almost like controlled chaos, but it can be very, very challenging. And if you're a patient, especially in the pandemic situation when there's already that fear of going to the hospital, navigating it can be very, very difficult. So, just a couple of things before you continue, Tracy. I just want the viewers to know there's a website that's scrolling on the bottom of our screen. That's actually Tracy's website that she started, and we shall talk more about that, and we'll show a couple of videos in which she discusses and is it help she uses to help people to empower themselves to be better advocates, which is the theme of this whole show today. And so I just wanted to point that out to you guys, just in case people were wondering what that random website is scrolling. So if you want to have a look and check it out, and we'll go into it a little bit more later on. But this is the website she started, even though it says women doing for women, right? But this is, you're saying you've expanded to both sexes now, and it's gonna include everything, men, women, all genders, and it's essentially about patient advocacy, right?
Yeah, absolutely. I'm opening up another website, probably in another maybe 2 or 3 weeks. I'm starting another one so I don't exclude half the population. This is kind of a brainstorm that I had while I was sick with COVID. Sick for about 2.5, 3 months. I was out of work and woke up one day from a dream, and I'm like, oh my God, I gotta do this. Because, I
Uh-huh.
talked to a couple of my ER doctors, and they're like, it is so needed. We need that so badly. And, I discussed it with you, Jack, too, even a little bit. And you're like, oh my God, this is so needed. If we can even get some of the very basics out there and the knowledge to the population would help immensely. And especially right now in a time of COVID, where you could go into an ER, be okay 1 minute, and be intubated in 10.
Right.
We just have,
And who's going to make all the decisions on your behalf, very ethically, challenging decisions, medical decisions, and sometimes you don't want to leave them on your kids or loved ones to make these. So how can you be prepared for those? Again, that's a little bit outside of the scope, but all of these issues. Um, and the other thing that I wanted to mention before we get into the meat of the stuff is that we will be taking questions from everybody. So if you guys have any questions, please start dropping them here, and I will scroll through them one by one, and Tracy and I will address them, mostly Tracy. And if you have any specific questions, so Tracy, let's get to the main point here. What is it that you're going to do? Tell us in one sentence. What is it that you do? Why is it important? And why are we wasting people's time on a beautiful evening like this, listening to you talk?
definitely. Well, it is my goal to get everybody out there, give them some kind of education on the most important things that you're going to need, and have it just even in your wallet, some of the basic stuff. So when a paramedic comes to pick you up and you're unconscious on the ground, be it an accident, a car accident, been hit by a car or been in a car accident, we have the information, you have it with you. So you can actually, we can get the access to information, we can contact a family member, and we know what your basic allergies are. And I'll go into that a little bit more, but I'm going to teach you guys, my goal is to teach you guys how to be your own health advocate, because how are you supposed to know how to be your own health advocate if you've never been in the medical field by a nurse or a doctor, or even a respiratory therapist or an x-ray technologist? You
Right.
don't. You're not going to
Right.
get this kind of education. So it's so important that we get this out there, because that 10, 11 years I spent in the ER, I get patients come in and they're completely lost, totally
Right.
lost, just on the basics of what their problem is. So
Especially on a Friday night or a Saturday night where the ERs are jam packed with trauma, and in some of the major emergency rooms in the country, especially now again, people assume that somebody's following up on them, or there's somebody that's gonna take care of them from A to Z, and then they get there and they're just sort of like deer in the headlights, right?
yeah,
So
absolutely.
so what are the top three things? Let's start off with that. What's the number one thing that you want to tell the viewers is important? Let's start from there and work our way up.
Yeah. So I put together this cool little list on the biggest things that we've encountered in the healthcare industry, is a medication list, right?
Mhm.
You
And
come
this is
in.
on your website?
This is on my website. I've got to put a link to it on my website.
Okay.
Somehow, gotta figure that out, but it will
Uh,
be. This medication list up in the upper right hand corner actually says um, family member ICE in case of an emergency. So this is going to be who we contact when we find you unconscious, or who do we contact and we're in the ER and suddenly we have to intubate you and we haven't been able to get a hold of a family member yet. Even your
right.
blood type. We put the blood type here and we want it updated. I don't want to see a list that was updated a year ago, right?
Hmm.
Your medications on one side, the dosage.
And when you say updated, from a physician's perspective, every time you go see your primary care doctor, every time you're in a hospital, every time you're seen by a physician, ask them to consolidate your medications and only write down the things that you're actually taking. If you discontinued something a month, 2 months ago, it may still be on the list, but if you're not taking it, have them remove it and update the list so the people know what you are currently taking, right?
Absolutely. I mean, and that could be critical, right, Jack? I mean,
Yes,
we could
very much so.
give them something that could be not good because it could be contraindicated for that medication they're already taking.
Right.
So
Things could have been moved
super.
around. Your nephrologist could have, your kidney doctor could have changed something, and then your heart doctor changed it back, and now they stopped it. But then when you don't update the list, you come in and you end up getting both medications. And again, there's also safeguards in a hospital setting to prevent some of these things, but mistakes do happen. So if you have a beautiful list chart that Tracy's talking about, then you know that the confusion could be minimized.
Absolutely, because some patients have 5 specialists.
Right,
Right.
right.
So my list here actually has on the one side, it's not just a regular medication list. It has the doctor and the specialist that is actually giving you that medication. So we can actually contact that doctor if it's actually a condition that's maybe you're coming in for chest pain and it's, your
Mhm.
troponins 0.04 and now we got to send you to the cath lab. I have a doctor I can contact right away and I know who to contact right away. Say, hey, I got your patient in here.
And
So
Tracy, when should I be making this list? In the ambulance as I'm going to the emergency room?
yeah, no, oh my God, make this actually today, tonight, because you never know when you may be that person. You could be driving to the store tomorrow, tonight, and get hit by a car, another car,
Right,
and you could end up in my ER and unconscious with no
right.
family member for us to contact. And now
And where
it's
should
like,
I be
what do you do with them?
putting this list?
In your wallet. What I like to
Well,
see it's going to be on both sides. Your bill folded up, and I want it put behind your driver's license or in the middle of your billfold. because
Mm.
paramedics are going to be looking for this stuff. They're going to pull your driver's license, find out who you are, and behind that driver's license, they're going to see this list of medication. They go, "Oh, look at that. Let's go over this, so we know what we're dealing with."
That's
Super
an
helpful.
excellent. It's a simple solution to a very, very important
Huge
problem.
problem.
Yeah,
I can't tell you how many times I got patients in unconscious for whatever reason, and we have no idea how to treat them because we're like,
right,
well, what's wrong with this person? We're trying to go through the list of what could be wrong with this person, especially if they're found unconscious on the street and the paramedics bring them in.
right.
They,
And
with the
I've even seen people coming in with family members, but so you ask them and they
members
say,
don't even
"Well,
know.
I don't know what grandma was taking." Grandma
Exactly.
knows, and grandma just knows the color of the pills that she's supposed to take the number. So again, it's
I
not
take a
necessary.
triangular blue pill at
That's grandpa's pill.
yeah, right.
uh,
So that doesn't help, man. Like there's a million triangular blue pills.
right, right, right.
So
So
super, super important, you guys. Keep your lists up to date. That is going to help us, the nurses and the ER doctors, and even your basic doctor. Take this to your regular doctor. Make sure all the medications are correct. Your cardiologist, your nephrologist, your regular internist. Make sure
mhm,
it's all correct. That they have the correct list in their computers. I
awesome.
can't tell you how important that is. And then on the bottom here, it actually says allergies, right? I want to know what you're allergic to. Okay, if I have to give you something to save your life and you're allergic to it, now I've complicated the problem. And now we have to give you something else to counteract that problem. And now what that has done is delayed us in our ability to treat you and get your issue resolved. So if you're allergic to some kind of steroid and I've given you a steroid because you're having an anaphylactic reaction or a respiratory issue, and we give it to you, well, now we've caused more of a problem. Now we've
Right,
complicated that issue, and you know what? And it could even kill you.
right. And sometimes even gloves can cause allergic reactions. I
Yeah,
mean, now
latex.
there's less and less of those being used, but sometimes I still find them in hospital settings, and people could become latex allergies, and somebody
Severely allergic to
severely,
latex,
yeah,
and even peanuts, right? So
peanut,
something like foods like you're severely allergic to peanuts or maybe fish. We're going around. Sometimes we're eating peanuts, and we go in our
right,
break room. We grab some pan full of peanuts. We wash our hands. We come to treat you. It could be on our scrubs, and we could wipe our scrubs down. We can touch
right,
you,
right,
but now we've transferred it to you. So anything you're severely allergic to, anaphylactic allergic to, that should
yeah,
be on your list of allergies. And that could
awesome,
be a life-saving thing. Paramedics going to pull this and go, oh, I can't go
right,
with that.
right. No, that's a great idea. And again, they could find in the near future this on your website, right? I mean,
Absolutely.
something.
Yeah. I'm going to get on
It's a
there and
good template to start with. You
post
know.
the link up there tonight. And then the other half of this, the other side, do it a 2-page side because I don't want 2 pieces of paper in your wallet. I want one page I can pull and I can open. I can look at the back and look at the front, and we have a really good clue to how to treat you. On this side is your medical history. On the back side will be your medical history. If you come into us and you're unconscious and you're diabetic, we pull this. We're going to usually do your sugar right away. Anybody who's gone conscious, we're doing your sugar. We're going to see that you've got a sugar of 20 and you need D50. But
Right,
if it's not necessarily so clear, it's going to be
right,
on here. Heart attack, 2005. I'm like, oh, I got a guy that's got a heart condition, and maybe we should look deeper into what's going on here. Or a guy that had a bowel obstruction, right?
yeah,
So you have a blockage in your intestines, right? And you come in and you've been vomiting all night. Suddenly you pass out. Somebody calls 911. They see this and they go, "Oh, he had a bowel obstruction and
right,
a surgery in 2016.
right,
Maybe we should do a CT scan of his abdomen and see this is what's going on."
right. So, and again, that's something that you can make with the help of your physician, your primary care doctor, that could help guide you to figure out what are the important and key medical conditions and procedures and like you're saying, maybe even imaging that you've had I mean, you could have a whole laundry list. I've seen
We
people that
want,
have,
yeah, a huge list, right? We want the really important stuff.
right,
MI,
and
stroke, stuff like that.
your physician, and again, Tracy could also help guide you about the major things. If you had a broken pinky nail, we don't care about that, right? But if you've had
Right, exactly.
a non-obvious stroke that, you
Like,
know,
somebody who's had any kind of brain surgery and they have a stent or a drain. Oh my God,
right,
super important, right? Super important that we know that, because you could have, encephalitis. And it would
right,
be right here. We'd be like, oh my God, we need to get a CT scan of this guy's head right now. That's probably why
right,
he's unconscious.
right,
So, and on here, it's got, the date of occurrence, if it's currently active or resolved, and the doctor and the specialist and the number of that specialist that is treating that condition. So we can just say, look at it right away and go, we're calling Dr. So and so.
yeah.
So we can find out more about this person.
So I would like to call this sheet of paper your health social security,
Yeah.
number, right? It's got all that information, and it's nicely packaged so that information is easily accessible. And again, you don't want to make it too busy because you don't want to be reading through
Yeah.
tons of stuff. So the way you have it set up
Huge
is,
laundry list, just like the
yeah,
most important stuff, like Jack said. So, I mean, what would you consider important, Jack? The stroke, the MI, what else?
stroke, MI, history of, let's see, history of, those are the main, like surgeries, what type of surgeries they've
Yeah.
had, if they've had
Emphysema,
appendicitis,
COPD, right? Severe emphysema, COPD, definitely
yeah,
diabetes,
diabetes, yeah,
right?
those major things. History of surgeries is very important, because if you come in with an abdominal pain and you don't have an appendix, it's already been removed. I'm not thinking appendicitis anymore, right?
Yeah,
So
exactly. Or the gallbladder, right? Severe
yeah,
abdominal pain, gallbladder's
yeah,
already gone. All right, well, it's definitely not the gallbladder
gallbladder, yeah.
unless it's stuck in the junction.
Yeah, but so major things like that, and again, your physician, when you see them for your regular checkup, it takes a few minutes. You can sit down and have them
Fill it
help
out.
you write it out. Yeah. Don't
Absolutely.
have your physicians write it though, because
No,
they have poor handwriting. You do them yourself so that you can actually
you can
read
read
it.
it.
Yeah, or have it typed out later. But yeah, no, that's a fabulous, fabulous idea, and I think it's a good thing to have people be ready for it. So that's number one, Tracy. Give me number two.
On that, and actually, I have one more thing on this list.
Oh, sorry.
Yeah, that's all right. Your code status.
Oh, very
Code
good.
status means advanced directive. For those of you that don't know what an advanced directive is, this means, what am I going to do with you when your heart stops? Am I going to do CPR on you? A lot of people want CPR, get their heart going, but a lot of people don't want a tube stuck down their throat and keeping them alive the rest of their life, or a tube stuck in their stomach to feed them the rest of their life. We
Mhm.
want to know what your advanced directives are. If it's written down here and it's on your list, we have a better chance of knowing what you're going to want to do, and there's less of a fight with the family members.
Right,
A lot of the times, the family members want something different than you do, right? Nobody wants to lose their family member, but if you're like, no, don't keep me alive on a vent the rest of my life, that's not what I want. If it's written down, we have
right,
a better chance of being able to treat you. I mean, if
right,
you're a DNR, which is do not resuscitate, and you come into me and you don't have that piece of paper on you, I'm resuscitating you.
right, right. And again, this paper will only guide them, but of course
Only
you will
guide.
double check to make sure that their legal paperwork follows.
Absolutely. You're going to want that legal paperwork with you. Your pulse has got to be signed. It's got to be the doctor and by you. And that's important. This will just help us decide
Get to it
what we
immediately.
want.
Yeah.
Yep. Yeah. So that's,
Awesome. Great, great idea. So what's number two? Give me number two, Tracy.
I want you to know when you're having an issue, right? And you're like starting to have some, let's just say, abdominal pain, right? You're like, oh God, stomach's kind of hurting. You're starting to throw up. You're having some pain and some stabbing pain. I want you to write down that time. When did it start? When did your pain start? Even if it's, even if it's just a little piece of paper, you write it down. How many times you threw up? how many times you've had diarrhea,
Right.
how long your pain has lasted you, right? If you come in with this information, because a lot of times I'll get the patients come in, they'll say, well, I don't know. I think it started a couple hours ago, or maybe even started yesterday, or, I can't really remember how many times I threw up. Uh, you know, we need that information. The more you don't know, the more we have to dig. And the more labs and the more x-rays, the more CT scans, the
Mm.
more things we have to order to figure out what your problem is. The less things we have to do, the quicker we know what's going on, the better your outcome is going to be. So when you come into the ER, you got to know what's going on. You got to have an idea of what the problem is. Don't expect to come into the ER and go, oh, they're just going to put a Band-Aid on it and we're good. I'm out the door. It doesn't work that
Right.
way. Right, Jack?
Hopefully it works out that way, but most of the time it does not.
Yeah, and most of the time, I mean, if it's a broken arm, all right, that's
Right.
different. If
Right.
you've stubbed your toe, if you ripped your toenail off, that's different. You got hit in the head with a ball, that's different. If you're coming in for anything that's medical, that's not trauma,
Right.
if you can write down what your problem is, when it started, what kind of pain it is, and all the little details in it, and you bring that piece of paper with you to the ER, or even your doctor, if you decide not to go to the ER and just go to your doctor or an urgent care, you have that piece of paper with you, and you hand it over to the doctor. The doctor's going to go, oh, this and this and this and this. Wow, this sounds like appendicitis, or this sounds like, let's order this and let's order this and let's order that. And chances are we're going to be able to treat you way, way quicker. You guys got to take responsibility for your
Right.
health. And you can't expect us to put like a real quick Band-Aid on this because it doesn't work, especially now, as busy as our ERs are, packed with COVID patients. Our doctors are overwhelmed. Our nurses are overwhelmed. We're understaffed. The more you know, the quicker we can treat you. And
And
the
the sooner you
better,
may be able to get
right,
out.
Jack? Tell me.
Yeah. And I think no, it's a really good point. Listen, if you're starting to have symptoms that are bothering you, stomach pain and the things that Tracy mentioned, these are really good points. Write them down. Even if you don't end up going to the ER, who cares? It's a piece of paper that you'll throw away. But if you wrote them down and then you eventually do end up going to the ER, like when did your headache start? It's a big thing. Did your headache start at like a level 5 pain level and then become a 10? Like if you can write these things, I know with the headache you might not want to be thinking about writing things down, but that might have been a slightly different example. But if you had a belly pain or something that subsides, write it down on a piece of paper. That way when you come into the ER, you're like, hey doc, the pain started 3 hours ago. It was sharp. It was on my left side. Now it's moved to the right side, and it went from being sharp to dull. That information could help
Vice,
make the diagnosis within
like
minutes as
that.
opposed to doing 3 CTs and poking and prodding you. So I mean, this is an excellent idea, right? If something is bothering you, write it down just in case you may end up in the emergency room.
Yeah, and even to your doctors, your urgent care, and say this thing goes on for days, right? It's not
Right.
bad enough for you to want to go into an ER. This goes on for days. How are you really going to remember what was going on like 3 days ago when you're uncomfortable and you're in pain? Probably not. The biggest reason people come into the ER is pain, or they go see their doctor, it's pain. That's
Right.
usually the reason. So
Right.
your focus isn't going to be on maybe other little minor detail, which might be our clue to say, oh, yeah, that's totally this, absolutely that. So if you can write down all those little details and you have that piece of paper with you, when the doctor comes in that door, or the nurse comes in that door to start to ask you questions, figure out what your problem is, you're going to have that piece of paper out and you're going to be like, oh yeah, that started here, you know what, that, and then this actually happened, and then I'm going to
Right.
be like, oh, what? Because you know what I'm doing when we're slammed in the ER, I'm getting your information from you because I'm triaging you at this point. How sick is this patient, and what are we going to be needing to do with you? I'm generally your first contact is your nurse. I'm going to go to that doctor that's going to be your main doctor. I'm going to say, they've got this, they've got that, they've got this. This is what our vital signs are. a lot of times we're going to go, okay, get this started, we're going to do this. Because he may be in that room resuscitating someone or putting a tube down someone's throat or treating somebody with a heart attack or
Right.
putting a foot back in place.
Right.
We're going to get your treatment started. So come to me. I want you to tell me the exact same thing you're going to tell your doctor. Because many times I
Yeah.
get patients come in, tell me something totally different than they tell the doctor when the doctor walks in the
Right.
door.
Right.
And
Right.
now we've started stuff that may have been totally. So tell your nurse exactly what you're going to tell your doctor. And then if I forget to ask you something, and you're going to have that on that list, you're going to
Right.
go, oh, wait a minute,
I
this.
also had
I'm going
a
to be, oh,
yeah, diarrhea. I forgot it's on the list. I had diarrhea. That could be a
yeah.
huge difference, right?
That could be the
Um,
difference between like a Crohn's disease or a Crohn's flare up or
yeah,
a Crohn's
versus
the
just
first time.
versus a hangover that you forgot you were
Yeah.
too busy drinking, right? So, yeah, no, these are excellent points. I mean, and they're very simple and things that can expedite treatment, could make things more efficient. Nobody wants to be in the ER, trust me, right? And so the more information you come in with, the faster things can happen more efficiently and the faster you can leave, right?
Yeah.
Um, so we got the data sheet for your medications and all the vital information. Then we have this excellent point of writing down things down when the symptoms start and bringing that along with you. These are fabulous top two things by themselves could save a lot. Number three, Tracy, give me number three.
I have to say, number three is you learn how to speak up for yourself. Okay. So if a doctor is coming in and they're talking to you and they're giving you this diagnosis, not diagnosis, and you're staying quiet and you're just taking it all for granted, and you have even the little bit doubt in your head, you need to ask them. You need to talk to them about this. You got to be like, well, but this and this and that, right? Because the doctors could be so busy that they could have possibly missed something. We're all human, just like the nurses. We're all human. You got to take responsibility for your health. All right, you can't rely on the nurse and the doctor to be you're responsible for your health. And in the end, we are for your emergency, for your treatment, but you have to be responsible for your health. You have to take care of yourself, and you have to be your advocate. So if you have your nurse is super slammed and your doctor is super slammed because we've got three codes going on or three people
Mhm.
dying all at once, don't be afraid to ask a question. Don't be afraid to make a statement, because it could be just that one statement that the doctor goes back and goes, oh, you know what? I did forget that, or I did forget to ask that.
Right.
So you can't, I mean, right, Jack? Tell me,
Yeah, think
someone
of
that
think
worked
of
on that
think
side.
of your think of the nurse and the doctor as your friend that you want to communicate everything with. Don't feel like there's this hierarchy that, well, I'm gonna say only things that they ask me to say. No, of course we want answers to the questions we're asking, but at the same time, if you could provide the details from your own, let's just say, and that would also be very, very useful. So again, speak up. You're there. You are unfortunately under the spotlight at that moment. It's your chance to say everything that you think might be important, right? And
Yeah.
again, as physicians and nurses, we're taught to sift out things that people say and just we listen to it, and it's kind of gets stored in a memory bank somewhere, but we know how to compartmentalize. So again, speak up, because even if it's information we may not need, we'll know how to go about it, navigate through it. So the more you're able to communicate, don't feel like, well, I'm here, they're going to do everything they need to do, I don't need to do anything. No, be active about it, right? Be proactive about it,
Yeah.
right?
What is your biggest experience, Jack, in this area? I mean, I know we don't want to be listening to somebody's whole life story. We don't have time to listen to your whole life story. We definitely need the important stuff. And and,
Right.
and but it's just kind of a hard thing to say. Um, because I had a bad experience with my dad's death. There were mistakes made, some big ones made, and he died.
Mhm.
And he didn't have an advocate there for him because I was told a little too late. So if I was there to be there for him and the right things happened at the right time, he'd probably still be with me today. Like I said, doctors are busy, nurses are busy. They may not have the time to be your advocate, or who knows what's going on. That person could have a lot of other stuff going on. You need to educate yourself about the system, right? So you know the basics of what an x-ray is, a CT scan, an MRI, an ultrasound. Learn about the basic lab work and what they mean. And I'm going to put a lot of this, the links to a lot of this stuff up to my website. The more
Mhm.
knowledge you have, the more you're going to be able to communicate with your doctor, right? So when
Right.
I went into the ER, I had this projectile vomiting. Started The abdominal pain started at work, and I worked through it and went home and took something for pain and some Zofran to stop the vomiting. Went back to sleep, was okay. Woke up about 3 or 4 hours later, just projectile vomiting, and I couldn't even stand. I was in so much pain. Ended up in my own ER with my doctors, and went there for a reason because I trust my doctors, and I knew exactly what to tell them, what to say, and um, ended up with a bowel obstruction from boxing. But I knew
Mhm.
what I was getting into, and I knew what to expect. I knew I needed a CT
But
scan.
of
I
course, to
knew
be fair, you had been working in an ER. You had all that
exactly.
education background. So
Yeah. So what
we
I'm
don't
saying is,
expect
how are you
people to
supposed to
have
know?
right.
Right? You're not educated. You're not a nurse. You're not a doctor. You're not
Right.
any of this stuff. So if you even just get the basic information about what these things are, and when the doctor comes back to tell you, oh, this is what we found in your CT scan, then you're going to be like, oh, okay, I know kind of what that does. I kind of have a bit of an understanding what that is. So that way you can better communicate with your doctor. If you even have a little bit of knowledge, it doesn't you spend 6 years in college or 8 years, like, or 12 years. I don't know how many years you spent, Jack.
I,
But
I was like 6 years. That was just to get out of
that's like
yeah.
12.
Oh my oh
You're not, how
yeah.
would you know? You expect your nurse and your doctor to do that. But even if you have the basic information, then that's really going to help you and your doctor out a ton. Am I wrong, Jack?
No, no, absolutely right. No, absolutely right. And again, um, it's okay not to know these things. There's, with information technology. And if I understand this correctly, Tracy, these are things that you kind of work with people on to help
Mm-hmm.
them kind of understand and get.
Yeah,
So,
give them a little bit of education about the medical system on my side,
okay.
so they can
So,
go in more power and knowledge.
let me see if I could do this correctly and get, let's see if I can make, um, do a share screen. Um, let's see. And be able to show people uh, your website. Let's see. Are they able to see it? Are you guys able to see this? No, no. Looks
Let's
like
see, Firefox and
yeah. Let
go
me let me see if I can.
on.
Um, let me see if I can do this correctly.
While he's doing that, I also talk about health in way of fitness, nutrition, right? I want to try to
Mhm.
keep you guys off pharmaceutical medications by taking care of yourself. All right,
Are you guys
pharmaceuticals
able to
aren't
see
good for
this?
you.
Sorry.
There we go. That worked. That's up.
Yeah. Okay. Keep talking. So this is her website, but keep talking.
um, so everybody's looking for that band-aid, right? You want that medication, just put a band-aid on it and fix it, right? Well, these pharmaceuticals aren't necessarily very good for you. They all have side effects, and they all can
Mhm.
cause more problems sometimes than they can cure. So pharmaceuticals absolutely have their place. Absolutely they have their place, but you guys got to take better care of yourselves, right? You got to
So
take responsibility for your health, right, Jack?
yes, exactly. And this is a good lead way in segue into the this is the website that Tracy has, and we'll kind of go through it a little bit. So here, she talks about take control of your health again, right? We'll go into this a little bit more. So Tracy, kind of walk us through as I scroll through it. This is Tracy when she was. Is this when you were getting ready for the Olympics?
Yeah, I was on my way to my Olympic trial number 2, actually.
Awesome. So
So I
outside
know
of
a lot
hockey,
about
she does
health.
boxing as well.
And on the left here is when I volunteered for helicopter flight rescue.
Awesome. So she's
So
had multiple hats over her lifetime. So these are the things she's done. I don't see any hockey pictures. I'm disappointed, Tracy.
that's coming.
Yeah. So this is about what is this here? The
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 journey
jour-
towards health, start now. That's basically how you can book a consultation with me on all these things. These are like the snippets of what I do for my consultations, what we're in Jack and I are going over. And there's a video in there on right there about why you
this
should get
video.
consult. Yeah,
Yeah.
I don't know, it's
Yeah.
about
Let's
30
take.
video, but it talks a lot
Okay.
about why.
All right. So this is you actually doing a consult with somebody.
No, that's actually my friend Karen. She came on and we discussed. I wanted to give everybody a little video of why I'm doing these consults, why I
Awesome.
decided to open the website, and why it's so important to me. I had some things happen in my life through in my family that pushed me to want to help other people. So what happened to me doesn't happen to them and their family.
And so here you have weekly health tips that people could sign up for and get like a newsletter.
Yeah, I do a weekly health tip on all the things I've learned throughout my career. It's all healthy stuff, nutritional items, um, or fitness tips of the week, anything that involves how to stay healthy.
Awesome. And so she also has a YouTube channel, Facebook, and I believe that's also Instagram. So you guys could find those on there um, as well if you want to get in touch with Tracy and keep up with her health tips. And so I guess this is a very nice website discussing about what you do and
Yeah,
how they could get in touch.
if you
Mhm.
go to nutrition and you click
Um,
on the drop down bar, I do the blog too. So the blog here talks about I do all the little things that like I talk about why there's videos there, also like books on like some of the women's health books kind
mhm,
of stuff on how to help female stuff,
mhm.
all the things that I take to help keep myself healthy and all the information on them. um, so if you had questions about them, um, I spent 2 months pretty sick with this COVID, but I think the reason I did so well on it is, well, that I'm still here,
You're right.
is that I take really, really good care of myself. I'm active every day. I take certain nutritional products that are totally natural and organic that help to keep me healthy. And I eat really well. I try to eat really well. Every once in a while, I'll have that piece of pizza.
Of course, we all need to indulge ourselves once in a while.
And
So,
I had some ice cream last night.
let's say if I'm a person watching this and I'm interested in getting to know Tracy, I mean, what does it take? They just contact you via the website and you get to talk to them
Yeah, my
and
number's
you
on the
just,
website. Also, there's Gmail contact on the website as well. You can just submit a form as well. You can chat with me through the website. So there's all the different objects.
so do you have like specific plans of like, hey, I want to know what are the things I need to do when I'm in the ER, before the ER. I want to know what are the nutrition things that will keep me healthy and alive for long periods of time. Do you have like specific things that people could poke your brain for?
Yeah, absolutely. Yeah, I do. I have all these, actually a lot on my site regarding the products that I take myself. I don't put
Mm,
anything on my site that I believe to be I don't want to say dangerous, but not healthy for you.
Mhm.
Like a lot of vitamins have fillers in them, and you're just basically peeing out expensive pee. Am I correct, Jack?
Yes, yes, it's not just Flintstones, it's more expensive.
Oh, right, exactly.
Yeah,
So a lot of these
it's
things,
useless.
yeah, I educate you guys on how to stay away from nutritional products that may not necessarily be so good for you. They just be gimmicks. Um,
Right.
so with my consults, I do all that kind of stuff. So I also talk about not just how to be your own self advocate. And if you ever need an advocate, you can always call me. Hey, I've got a family member in the hospital. This is what's going on. What do I need to ask the doctor? No, I can't prescribe, nor can I diagnose, and it will not. It's not under my license. But I can help you ask the right questions when you need to ask the right
Wonderful.
questions.
So you're
So,
like a really good, buddy system that they can
yeah,
use to kind of navigate through. This is awesome. And so, what are some of the confusions you felt like patients go through when they're in the ER? Are there any other um, sort of um, confusing moments um, that you think could be addressed in the next, you know,
5 minutes.
5, 10 minutes? Yeah, like in
Uh,
terms of like knowing what the next step is, or why are things taking so long? What am I waiting for? You know what I mean?
yeah, so we get this all the time. You're in an ER, you're coming in for, let's just say, a bellyache. These things take time, you guys. It's not going to be in an hour and out. It's just not. We have other people that are very sick. Some may not be very sick, but they're all in line for a CT scan, or maybe not all of them, but a lot of them, or an MRI or an ultrasound, right? It's not like, okay, the doctor orders an MRI and the CT guy goes, or MRI goes, oh, I'm good, let's go. There's a patient in there before you, and some of those MRIs take 30 to 40 minutes. CT scans,
Right.
some of them can take up to 20 minutes. Your labs, they can get done pretty quickly, but there's some lab works that take longer than the 30 minutes to come back, right?
And
And
and, and let me add a note to that. Of course, we're living in the post-COVID era, and so in fact, MRIs and CTs can take even longer nowadays because in between patients, the wipe down in most institutes are,
clean up.
yeah, and
Yeah.
and, and so we try to separate, you know, COVID patients and non-COVID patient MRIs and CTs, but some places don't have that luxury to have multiple machines.
Yeah.
So if somebody with a COVID positive comes in and they get scanned, you need to wipe that thing down really clean before you bring somebody else in. So that adds extra time into it. This is not an excuse for laziness. It's just for people to know that there are things happening in the background that you may not
A lot of
necessarily know
things.
about that could cause frustration, right?
I mean, we may be in another room resuscitating someone. We may be in another room putting somebody under a moderate conscious sedation to put their foot back into place, right? And then
Right.
spin it. So these doctors, there's usually only, wait, maybe 4 doctors in an ER. I mean, we had 3 doctors. They were lucky in my little ER, right? 30-bed ER, 3 doctors, 2 PAs, right? The physician's assistants see people that are less sick. Those 3 doctors are treating 30 people, you guys. 30 people.
That's that's at any one time. I mean,
Yeah.
I worked
With
in the
all
ER
sorts
and
of crazy
I
things
myself
going on.
could see at least 30 in one shift, and I wasn't even
Easy.
the, yeah,
Easy, right?
easily.
And like Jack, you could be intubating one and getting T paste to another,
Yeah. Yeah.
right?
And
So your little crack in your finger, little broken finger, you're going to be
yeah.
waiting. All right. So guys only need to go to an ER when you absolutely need to go to an ER because you're really going to be waiting a long time, especially during COVID. I mean, you could easily get 4 hour, 6 hour waits for a very basic issue. Am I wrong, Jack?
But having said that, Tracy, I know because of the COVID, we were telling a lot of people not to go to the hospital if they're
You
sick. But
definitely
now,
need to go if you're having
if you're
chest
sick,
pain.
go. If you're
Please
having,
go.
yes, go to the hospital. Do not be afraid of COVID. Go to the hospital. We've got measures put in place for you to be able to be safely taken care of without the concern for coronavirus. So do
Absolutely. I
not
mean, how many
risk
people?
getting a heart attack at home just because you don't want to get COVID, right?
Yeah,
No
like
point to
people have
dying
died
and
now.
not having COVID.
Yeah, a lot of people have
So,
died because they didn't go to an ER because they were afraid. We're going to protect you. Okay, you're going to be in there. You're going to be masked. All of us are masked.
right.
We will. They are very very good about preventing transmission to each other in the ER. You have a if you're having chest pain, you don't go to an ER. You may end up dead the
Right.
next morning or dead the next 10
Yeah.
minutes. Then what's COVID to that, right?
Yeah. Right. So do not compromise going to the hospital. But again, um, be smart about it, right?
Absolutely.
So
Use your common sense.
right.
Or
So
when my boyfriend says good sense.
because it's not common sometimes, you know. So overall, you're able to guide people about the ins and out of the R, and it's great. You're in there all the time. You know where people got, and also health and nutrition. So you could be a great resource for people. At least hold their hand from the beginning, and then once people feel comfortable, maybe they could then build on their own and kind of grow themselves, and it will help. And I think these kinds of movements, and I just call them grassroots movements, are what's going to change the healthcare system. I truly believe it. We could do all kinds of stuff on the policy level, but unless we Americans um, start owning our health
Absolutely.
as a and being responsible for it and taking control of it, we are not going to better the healthcare system
Absolutely not. You
on a
guys have to
global,
start taking
larger
care.
level, right? If you
You
don't
guys,
care about your own diabetes, your own high cholesterol, your risk of getting stroke and cardiovascular problems, the doctors are not, the nurses are not gonna give you a magic silver bullet. You
no.
need to own it up and do the right things, right? Be prepared. Nobody wants to go to the hospital, but do the things that Tracy's saying, just so that when you're there, you get boom, boom, the right care, right? And also follow her when she talks about eating healthy, doing the right stuff, so that you could avoid seeing Tracy and I or any other doctor, period, right? So,
Yeah, you got to take care of yourself, guys, especially right now. Take care of yourself. Eat right. Exercise. Be smart. Wear the mask.
oh yeah, that's right. So again,
You
so let's
have
talk a few minutes about the COVID situation going on. And as you know, I've been really angry today. You could have probably seen me on Facebook. I've had multiple posts because of, it feels like what is that mythological creature where you cut the head off? Medusa, right? Where you cut the head
Medusa.
off, and
Yeah.
there's 10 other ones. So initially, I had been chasing these videos of people posting about, we had various doctors posting about issues with the pandemic, non-science. I got nothing personal against them. It's just I get irritated when it's non-science based. And then so I would attack these, and then I realized like there's 10 more popping out, and it becomes overwhelming to kind of go after it. But you know if you remember, going back all the way to March and April, even a little bit earlier than that, I was one of the biggest advocates of hydroxychloroquine myself. I really thought mechanistically it's a good drug that could really work. I thought it's an immunosuppressant given at the right stage. It had antiviral properties supposedly. I had many, many arguments with people, and in some, I made myself look like a fool because I really wanted something to work. And when the data started coming out, I said, Jag, you're wrong. You were wrong. There's no fact. I mean, and science doesn't care about our feelings, right, Tracy?
No, it does. It does
Science and data
care
is
about.
what it is.
No.
And so now I made it a point to literally read every single clinical trial study that has come out on hydroxychloroquine because I needed a something to hold on to and say this drug could help, because we had nothing at the time. Now we got steroids, remdesivir, we have
Yep.
tocilizumab, and there are a couple of other interesting drugs that are in the pipeline that I think are going to pan out. So when I now see that hydroxychloroquine on absolutely zero basis being advertised, not as a therapy, but as a cure,
Yeah. Yeah.
it blows my top off, right?
Yeah. I mean, even if it were, it's not going to cure it. There's nothing that's going to cure COVID. You can't cure COVID. It may be able to treat COVID
Treat it,
somewhat.
yeah,
You
right.
can't cure it.
Cure.
Your
Yeah,
body's
I
not
mean,
going to fight it.
and to make this a political issue, that just because we want to open the economy, we got to pretend that this drug works. I want the economy. I want everything to go. I want normal life. I don't want to
You
be
want to be back in the rink playing hockey, right, Jack?
more than anything else in the world. But again, it doesn't work. Now, if somebody said steroids, I'm on board. It's been shown to decrease mortality, tocilizumab. We got other ones in the pipeline. Let's leave this
And even
thing
the
to the side.
steroids doesn't cure it, right? It just treats the
It gives
symptom
you
of
enough,
it.
buys you enough time where you become well
Sure.
and you're
Fight
able
it.
to fight it. Now, we
Exactly.
don't know the long-term effects of COVID, right? We're seeing long-term effects. In fact, today we were discussing a paper about the effects on the heart in
My
people
stepdad
who,
just went through he had COVID, very sick, and it damaged his heart. And they had to go in to do a cardiac ablation to stop the arrhythmias. And then now they're finding spots in his brain. Did not have them before.
right? So when somebody says cure, I'm like, we just got rid of the symptoms, right? Cure is a different word where you don't see the entity at all. So again, when these guys come out and claim to be credible doctors and lie to the public, it's a lie.
Yeah.
Okay, to say that 300 people that they treated all were cured, I can't take it.
Yeah.
I mean, if you have that, please publish so that the scientific community could see it. That's how medicine and science moves forward, right?
Absolutely.
And if it's true, I will be the first to be ecstatic because I wanted this damn drug to work. But I know it's not true because they would have published the damn thing, right? It would have
Exactly.
been a New England Journal of Medicine.
And the peer
So
review would have been activated, right? It would have been
yeah,
published. There's no
right.
peer review that's been published on this thing.
It doesn't exist. That's not. I mean, that's how medicine works. Science works, right? Show me the
And
data,
educate
boss.
you guys. You guys got to educate yourself. Okay. When you're talking about
Yeah.
medicine and science, things have to be peer reviewed. It has to be proven. Okay. You got to start
Scrutinize,
scrutinize. Exactly. You got to go look into these comments or these things that people are saying. Don't just take it for granted.
right?
Research it for yourself.
Right.
Learn the
And
truth.
don't let just the white coat be an authority that you're gonna say they must be saying the truth. No, right?
Yeah.
The devil comes in many forms,
Yeah.
right?
Absolutely.
And so somebody saying it with authority, with shouting and like with conviction doesn't mean it's real. And and the other thing I would like to ask people is that those of us who are in it for the right reasons, and I gotta divulge that I have no financial gains or affiliations or any connections to any enterprise entity, drug or medication or vaccine development whatsoever, right? I'm just your off the street physician, science guy who is truly interested in helping. When we're trying to guide you and say, hey, don't be misinformed, people should understand we are not part of some system that's trying to misguide you. We are trying to point you in the direction that makes sense, right?
We want to
And
help you.
right, listen, if people like Tracy and I wanted to direct you. We wouldn't spend years studying medicine and health. We would have gone to some other, you know,
I would have gone into
um,
marketing or something, make
yeah,
money.
yes, exactly, right. Now talk about misguiding
Be a
people and
CEO
ripping
of
them
some
off,
company, right?
right? And
Or
so
doctors, nurses.
we're saying it out of our own good heart, and if you don't want to listen, it's really up to you. Goes back to Tracy talking about being responsible individual and taking control of your own health and being a patient advocate for yourself, right? I know what I'm going to do. I know what's right for me. You don't want to listen to what you want to do. I'm not saying I have all the answers or you should listen to me, but when we speak on behalf of a consensus of doctors, it's not that there's a big collusion of doctors, it's that it shows consensus that this group of individuals that pop out of nowhere are misleading you, right?
Mhm.
And they have no science. This is why people who have no science and data, what do? They scream, they shout, and they start becoming preachers instead of scientific advocates, right?
Yeah.
So, and just be mindful. Just be careful of the snake oil people might be selling you during these times. And just think twice before you think about what it means to be woke and who is the sheep, right?
Hmm.
Because I get that a lot. Any parting words, Tracy? Because this has been great. I could go on forever. Any
Totally.
last minute? I don't
Uh,
see any direct questions, but I'll give people a couple of more minutes if they have any questions. If not, they could always reach you on your website, so they can ask you questions, and we could go from there. But in the meantime,
take care of each other,
that's the last
guys.
word.
Be good to each other. Take care of each other. We do live in turbulent times, and we got to take care of our mental health, right? And we're all on the same. We're all on the same planet. We're all on the same page. You got to be good to each other. Take care of each other. You may not like wearing the mask. You may not like doing this. You may not doing that. But just think about, put yourself in somebody else's shoes. Put yourself in anybody else's shoes, and just think about what somebody else might be experiencing before you think about yourself. And take care of each other. You just take care of each other and take care of yourself. Take care of yourself.
Right.
Be good to yourself. Be good to your body. Give it the best chance it has to fight this virus.
Good point.
That's all I can say.
All right. Great ending. Thank you so much, Tracy. So I will they've seen the website on the bottom, and on the YouTube channel we could put also the name of the website. I'll put a link on there, and on the Facebook we could also throw that on there. Actually, I could put one in the comments. Let me do that really quickly. I'll put this in the comments section as well. Here's the name of the website. So just in case people want to, that's the name of the website. So if people want to go. All right. Thank you so much, Tracy. I really appreciate it. I've learned a lot, very insightful stuff, and I like the solutions to some of the problems you have. So let's get more people on board and get them done and make the ER a more fun place, as fun as it could
Right.
possibly be.
Yeah, for all of us.
Yeah.
Help us help you.
Yeah. Yeah.
Help
Yeah.
us.
Good point. Yeah. All right, Tracy, have a wonderful night. And to the viewers, thank you so much. And we'll see you next
Next.
time.
Thanks, Jack.
Take care.
You too.